We'll go ahead and get started. That's really loud, Caleb. Hi, Dr. Welch. So I emailed, well, I guess we can start with the approval of the agenda. If you guys have had a chance to look over the agenda, and we'll get you guys to make a motion to approve the agenda as presented.
I'll make a motion to approve.
A second.
All right, next we'll go to the approval of minutes. If you guys will take a minute to review the minutes, we'll accept a motion to approve the minutes of the meeting held August 12th, 2025.
I move for approval.
Okay.
I'll second.
All right, up next we have presentation. I'd like to recognize Dr. Katie Samuels to give an update on additional opioid settlement. All right, let's see. So we wanted to start off the meeting today to give you guys an update on where we are with additional opioid settlement funds, and starting with a recap of how we got to where we are and all the things that go on behind the scenes as far as approving sign-ons and what that looks like. So if you attended the last commissioners pre-agenda meeting, you saw that you could have seen the whole presentation, and they approved our motion at the meeting yesterday. So how we got there is back in 2021, the original North Carolina Memorandum of Agreement, which you all have a copy of. It's real fun, thick reading. Johnny Carswell is actually really instrumental in putting all of that together. So he was on a committee that advocated for the counties to get 85% of opioid settlement funds and 15% to go to the states. And that's really important because we're one of a handful of states that were able to get this money at the local level. Some other states, the state kept all of it. So we're really fortunate to be able to have 85% of the settlement funding that's coming directly into counties and municipalities for local boards and governments to be able to decide what to do with it on a local level. So 2021 was the original North Carolina Memorandum of Agreement, or MOA, and that set the framework for the distribution, accountability, and remediation. That was our original, this is what we're going by. So we didn't start receiving money until we signed that NCMOA. In 2023, we had an additional settlement agreement with Walmart, CVS, Walgreens, Teva, and Allergan. I want to say Allergen, but I don't know if that's right. So that sign-on allowed us to have even more opioid settlement money. And what this is like waves of settlements. It started off with the manufacturers, went to the distributors, now they're looking at pharmacies. So in 2024 was the SAAF2, which added the Kroger settlement. So they're stacking these additional settlement agreements onto that original North Carolina MOA. So started in 2021, and now what we're looking at is the SAAF3, which extends the existing settlement agreements to all of these other organizations. And it falls under that same MOA. So 85% going to local governments, 15% to the state. And the same rules apply to it. Funds must be deposited into the local special revenue fund and used only for MOA approved remediation strategies. And this takes effect once enough North Carolina subdivisions sign on. So the issue here is that pretty much everyone has to sign on to it to be able to get this settled and draw the money down. And then the local action required, which is what we did this past week, was for the commissioners to adopt a resolution allowing the county manager to sign on behalf of Burke County. And so another part of these additional settlements is the Purdue-Sackler bankruptcy settlement. So this is currently in court. $7.4 billion national settlement. All 55 attorneys general signed on. North Carolina's projected share is approximately $150 million over 15 years, and this required 2 actions from local governments. the first action was to vote on the settlement agreement, so vote on the terms of the settlement and how the money is distributed. And then submit the GESA participation and release form, which was sort of like the SAAF 3 sign-on. So that would allow us to be able to access some of this settlement money under the Purdue-Sackler bankruptcy settlement. And this is, I would say, the longest running settlement. Like, this is the settlement that started all of them. When I think folks started realizing that the Purdue-Sackler family really was behind all of the media and marketing that went into marketing to doctors and direct marketing to people, and they were really behind a lot of the misperceptions of what their product did to people. And so Burke County Purdue payments would bring an additional $2.5 million, and then the SAAF 3 would allow us to draw down an additional $413,000. So that, I think, brings our total to around 20, I think it was around 26 or 28 million. My mind math isn't math. So the action that we needed to take in the deadline, so we approved the resolution allowing the county manager to sign on to the SAAF 3, vote on the Purdue bankruptcy agreement, and sign on to the GESA. And so the vote has to be in by September 30th. The GESA participation form also has a deadline of September 30th. And then the SAAF 3, we need to sign onto that by October 8th. And I do believe that the county manager has already completed all 3 of those actions. All right, you guys have any questions about that? That was a really condensed version of opioid settlements. And so, next up on our agenda is an update on the approved strategies. So this section of our meeting, we're going to go through what we've done with the strategies that we have approved in August of this year. So these are our newly approved strategies. The county-led strategy update, we approved naloxone distribution, a community navigator, and the formation of the port team. So the naloxone distribution, we actually have found a vendor that offers naloxone at $22 a kit, which is a really good price. We've been paying around $32, $33 for a kit, so this will expand our dollars even further. We're also actively looking for grants or ways that we can get naloxone donated to us. The naloxone vending machine, we're already estimating that over the last 6 weeks, we've given out over 95 boxes of naloxone. The community navigator position, the position has been posted and we have 2 applicants so far. We're beginning interviews with those folks tomorrow. So we're going to start looking at hiring and onboarding for that position. And the port team, we have weekly implementation meetings, and we're looking at everything from daily operations, software, policies and procedures, and planning to start the interview and hiring process in the next couple of weeks. I believe we have interviews Friday lined up for our peer support specialist. The community paramedic and peer positions are still posted on the Burke County website. For our provider-led strategies, this was SACOT and SAIOP through a caring alternative, low barrier MAT through High Country, and family-centered treatment-recovery through Spark. We have executed all 3 contracts, and all 3 agencies are starting the hiring and planning process. We have had a couple of these providers start to draw down some of their startup funds. FCTR, they need to do extensive training to begin that, so they're drawing down those startup funds to be able to start training and getting that program implemented. And the same with a caring alternative and High Country. They're looking to go ahead and get started as quickly as possible. So we'll also be ready to start doing some formal reporting over the next month with all 3 of these. And before we go on to the next section, do you guys have any questions about our approved strategies? I want to say, I worked in local government for a while, and it's really cool to see something start in August, and a month later, we already have the contracts executed and are ready to go and ready to start supporting these providers financially and looking at, in just a few months, getting the port team up and off the ground. So we're doing some really neat stuff, and we're doing it quickly. So kudos to you all. So up next, and I'm sorry, Dr. Frank, I'm just going through your agenda. Okay.
Let me know if you need to call us over.
So up next, on September 27th, our annual opioid settlement report is due to the state. And so I've actually already got that submitted. And so the thing about the annual report is we could approve strategies, but if we haven't spent any money on that strategy, it doesn't go into the impact report. So like one example is we approved funding for collaborative strategic planning to do our strategic plan, but none of the funds were drawn down under that strategy, so it's not included in this report. It'll be included in next year's report as we draw down the funds. So what we did approve, we approved 2 strategies and different programs under each strategy. Opioid Settlement Coordinator, Program Coordinator, which is me and Brandy, Peers Partnering for Excellence, a Qualitative Data Project, a Public Health and Safety Team, and the Strategic Plan, which I mentioned is not included in this annual report. And then under Strategy 3, Recovery Support Services, we funded Recovery Corp. So the year in review, we have established an independent opioid settlement department, distributed over 1,000 naloxone kits across the county, launched countywide education and engagement campaigns through our public outreach, naloxone trainings, and participating with our partners in different events like the Recovery Rally, coordinated Peers Partnering for Excellence to elevate peer leadership, developed a videography project documenting lived experience that is then incorporated into the strategic plan, and we sustained and expanded Recovery Corps as an alternative to incarceration. And so I want to show you the video excerpt from the videography project. So we haven't put this on a website or anything yet. We haven't really promoted it publicly. The intent behind this really was to do, and we have the interviews of everyone that participated in this, to do this interview video project, to be able to incorporate that into the strategies that we use, and that'll go into the strategic plan. So it really was more of a qualitative data collection project that was then turned into a video, and we have an English and a Spanish version of this. So whenever we get ready to promote this on social media or on a website or anything like that, we'll have that available too. So in theory, I think this group is the first time that we've screened this. So it's a 4-minute clip of it. Do we have sound out here? Somber music.
Just narrate for us.
Do the voiceover.
When I was using opioids, mostly fentanyl, I maintained for a while until I couldn't, and it started by me losing my kids. Then I lost my home. I was living in my car and it got stolen. I lost everything and everybody around me.
This is something that have touched my family and one of my siblings.
Substance use impacted my daily life pretty much just by making me selfish.
I decided to be in this project because I work with a high Hispanic population, which I see that we have a lot of barriers. One is the language barrier. The other one is the cost.
My life has been totally uprooted and turned inside out, outside in, whichever way you want to call it.
It's rough, and it's always a struggle. You gotta get up, you have to persist of it. You always, if you ain't already got it, you need to find a way to get it. Sometimes it's not always easy. The money ain't always there, or even when you got the money, sometimes, drugs are hard to find.
Like it was hard to find a job with my background, and that deleted from doing things that I shouldn't do to get the stuff I wanted to do at the time to make me feel better, so stuff like that.
Substance abuse has impacted my life by far as my interaction with my family and my friends, things I do every day, period. Yeah, a lot.
Don't give up hope, because people are changing, just as much as people are dying. They need that help. And a lot of people who haven't never dealt with it have a certain opinion on it, and it could be anybody. I mean, opioid use can affect anybody. So I just want to encourage them to have an open mind to listening and helping the community help them.
Oh, for me to get off of it. And to be able to be in my son's life.
Not easy. It's not easy, but there's people out there that want to get better and change.
Don't just automatically judge people, get to know them. Find out what their story is before you pass judgment on them automatically. And just try their best to help them, not just condemn them. And that's all in all, it might not be today, but it could be tomorrow. Somebody you can offer a hand every day. Like I said, turn it down 1,000 times. But that one day, somebody will accept it.
I really hope the standards of education could improve so students could have more options to do in their lives.
Me and to get me back to where I used to be when I was happy and not on drugs.
There are a lot of reasons for hope. Burke County is a perfect example of why there should be hope.
So if you notice some of the language that people are using, we interviewed people not just with lived experience, but people who are living the experience, so that we can understand what they need, what would help them, what are the barriers they're experiencing, and how we can create strategies that are truly customized to the people that are living here that have the need right now. So it was, I believe we interviewed 10 or 11 people, and their voices will be put into our strategic plan, and they'll be heard. So it was a neat project. Glad we got to share it with you guys today. So a big part of what we did the first couple of years that we started spending opioid settlement money is heavy community engagement, data collection through the voices of people with lived experience, involving people from all stakeholder categories into our planning, and really creating a lens through which we need to view and approach the work that we're doing. So in 24-25, we engaged 315 unique individuals. So we tracked everybody that came to a naloxone training, a PPE meeting, an opioid strategy meeting, and we had, I think, over 1,000 impressions from 315 unique people. So that's 315 people in Burke County that we have personally engaged and have had impact into the work that we're doing. And 34% of those people reported as either themselves having a substance use or mental health concern or a family member. So we really try to incorporate that lived experience into everything that we're doing. And you can see here, a big part of our engagement is the naloxone training and distribution. And I'm going to pause here for a minute to turn it over to Brandy, our opioid response deputy director, to talk a little bit more about that engagement and training that she did over the last year.
Good afternoon, everybody. I think a lot of you know me, but for those of you who don't, my name is Brandy Greer. I am the Burke County Opioid Response Deputy Director. That is my current position. I've had a few positions here in Burke County. I started out as a peer support specialist about 13 years ago. Then I became a counselor, opioid or drug and alcohol counselor after I graduated from Western Piedmont Community College here in Burke County. Started working for the Cognitive Connection, so have some mentors in the room here, back there, Julie Walker. Then I became the Drug-Free Communities Program Coordinator at Burke Recovery, and then made it to the Executive Director at Burke Recovery. And now I am acting as the Deputy Director for the county's opioid department, so exciting stuff. This position is near and dear to my heart as I spent 15 years in active addiction. This is my 21st year in recovery, so I'm celebrating that every day that I'm still alive and I get to be here with you guys. Also, opioids specifically are near and dear to my heart, so just a little bit of self-disclosure. I lost my little brother to an opioid overdose when he was 19, my dad 2 years later, and just this past Christmas, my mom experienced an opioid overdose. So luckily, after 3 days in a coma, she did survive. So August the 14th, last month, she had her 66th birthday, and I got to spend that with her, and she was clean and sober, so that was pretty cool. So I'm excited, and that's because of programs like we're supporting here with the opioid settlement funds in Burke County. So I'm excited to be a part of that, and I'm excited for you guys to be a part of that, and I'm thankful for the opportunity to be a part of it. But that's not what I'm here to talk to you about today. So I just want to share with you guys some of the things that you're doing that are making a difference in the lives of people, and I'm get to be a part of, right? So I want to thank you for the opportunity to get to speak to you today. Katie's brought forth all of the data. That's not my thing. She's the gatekeeper on all the data, and I'm thankful that she does that. My thing is engaging with people. That's what I enjoy the most. That's what I like to be a part of, and that's what I want to talk to you about today. Thank you for your continued commitment to healing our community from the devastating impact of the opioid crisis, because that is what we are experiencing, is a crisis. And I'm here to share with you how the opioid settlement funds that were approved by the Board of Commissioners have had a lasting impact, and how we've been utilizing them specifically through the Peers Partnering for Excellence, and more importantly, to highlight the meaningful and measurable impact that this investment is having on our community. So Peers Partnering for Excellence is a network of peer support specialists whose mission centers around lived experience. Our peer support specialists are individuals who are in recovery themselves and are uniquely positioned to walk alongside others who are beginning their own recovery journey. These funds have allowed us to elevate this vital work, increasing access to services and expand our footprint across the entire county and outside of this county. So what we have found is, since we began having our meetings last September, the word has spread. So not only do we have peer support specialists who are from Burke County but may work in other counties who attend our meetings, but we have peer support specialists who live in other counties but work in Burke County, so they're now coming to our meetings, but they're all vital to this community of peer support specialists that we're trying to serve and support, right? So we invite them and welcome them all, and that's actually growing outside of our county too, because what we find out is when something good is happening, people want to be a part of it, right? So don't be surprised if this is a huge regional thing before you hear from us again next time. Thanks to your support, PPE has supported the development of peer support services in our community, ensuring that they are sustainable, effective, and accessible. They've advocated for best practices in the peer workforce while also supporting newly certified peer support specialists with training, mentorship, and continuing education opportunities. I would like to mention that the support and working relationship that we have between the PPE group and the Hope Center, that we have supported 6 that we can think of off the top of our head through continuing education opportunities, 7 peer support specialists that we have seen them get their certifications and become employed peer support specialists here in just Burke County. So who knows how many of them have gone on to become peer support specialists in other counties, but that's literally just right here. They got their certification here, and now they're employed peer support specialists here. So talk about like a workforce pipeline, like that's already happening. And it was unintentional in the beginning, but we're watching it develop right here, you know, in front of us. So that's exciting, I think. Thanks to your support, we have created a strong network of collaboration and resource sharing that is both local and statewide. We've implemented quality improvement tools, including standards of practice and accountability measures, and placed a major focus on reducing stigma by amplifying the voices of peers, challenging stereotypes, and promoting understanding. One of our proudest accomplishments this year has been our collaboration with APNC. If you're familiar with them, that's the Addiction Professionals of North Carolina, on a poster campaign that we've been able to recreate right here in Burke County. These posters feature powerful images of our own local peer support specialists with 3 quotes on them. What's really cool is that my poster boy is here. I hope I don't offend him by calling him that. But Chris Ottstott, he's sitting back there. He's going to be up here talking to you in a few minutes. But this is just an example of one of our posters. So there's a quote from their past, which reflects their struggle, a quote from their present showing the reality of the recovery that they're experiencing, and an inspirational message directed at the still suffering person who may not know where to turn. This is just some of the people in our Peers Partnering for Excellence group. Each one of these posters features an individual down in the corner who has their personal quotes here, but there's a tear-off section that has a list of 24-hour support resources, treatment centers, crisis lines, suicide prevention hotlines, and mental support services, right? These are at all kinds of strategic places in the community. They're at the jails, they're at probation. You want a picture of it, Katie? I'm sorry. Thank you. All right, they're at probation offices, they're at the courthouse, they're at the health department, Department of Social Services, treatment facilities, NA and AA meeting spaces. The community has really worked with us in allowing us, sure. What's really neat is when we go to events, and I take these just for people to look at, the amount of people who come along and take the tear-offs with them, because people are crying out for help, and there's an opportunity for them to get that right there just in a simple tear-off. And the most important thing for you to know about those posters is that they work, because I have literally have peers who have walked up to me directly and say that they are working with individuals who saw the poster, tore off a number, and made the call. And that moment of connection made possible by your investment, where you guys said, yes, we're going to put a little bit of money in this PPE group. That's what created that. And that moment of connection made possible by that is often the very beginning of recovery for somebody. These posters remind people that they're not alone and that help is just a phone call away. So PPE is also taking a lead role in community engagement by hosting national and local awareness events. Most recently, we organized and led the community's Overdose Awareness Day event. A lot of you folks actually showed up for that. I've seen some familiar faces there, and that was a lot of fun, if you want to call that fun. We actually did try to make that fun. People enjoyed it. They smiled. They laughed. There were a lot of tears there too, but people were able to remember folks who they lost and celebrate it in a kind, loving way. And I thought that that was beautiful. It was powerful. It was a powerful gathering that honored the lives of those lost, offering hope to those who are still struggling also. This is just the beginning. We intend to continue hosting events like that to raise awareness, reduce stigma, and provide resources related to substance use and recovery, especially around opioid use. As a part of our commitment to remaining visible and active in the community, we consistently show up for things like health fairs, recovery rallies, resource fairs, and job fairs, and other public events where we serve as both advocates and educators. At these events, we proudly represent the Burke County Opioid Response Team, helping to raise awareness and share clear, accessible information about what opioid settlement dollars are doing for our community. Excuse me, our presence ensures that the public not only sees the faces of recovery, but also understands that these funds are working. That way that they are saving lives, creating opportunities, and supporting long-term recovery across Burke County. In a major step forward, PPE has also accepted the role of the advisory board for Burke County's RCC, or our Recovery Community Center, the Hope Center, located at BUCM. In this role, we will provide guidance and leadership and ensure that programs and services offered will remain relevant, effective, and aligned with the evolving needs of our recovery community. Oh, and as it turns out, this is like a small flex, but I thought I'd put it in there. Turns out that PPE is the first and only one of its kind. We haven't heard of this happening anywhere else, so I thought that was pretty cool, and we should share that with you guys. We hope to be going to the North Carolina One Community and Recovery Conference in March to share more about it and for the state so that everybody can find out about it. We don't want to remain the only one of its kind, so hopefully more folks will catch on. Peer support specialists need support also. Everybody needs support, so we think that that's something that could catch on and become popular. I do have a question. I didn't see naloxone up there as one of the strategies when you made the second list. Is it okay to talk about the distribution and training? Yeah. Okay. While the broader work of PPE has been foundational to our community's progress, I wanted to clearly emphasize that the opioid settlement funds directly supported two critical life-saving efforts, also naloxone distribution and training, right? So these funds made it possible for us to get naloxone and overdose reversal medication you guys are all familiar with into the hands of the people who needed it the most. But we didn't stop there. We tried to pair every distribution effort with hands-on training. So we weren't just handing it out and hoping that people knew what to do with it. We tried to, if we couldn't perform the 45 to 1 hour minute long training, we tried to at least give a 5 minute long training, right? There's some easy steps that you can, we've made this infograph. I don't know if you're interested in passing that along also with the Pill Place Press on there so folks know how to do that. So even at gas stations, when I stop and hand out naloxone, even if there's a language barrier, we can show them a picture, right? Or we can give an example of how to do it because we have a lot of, unfortunately, incidents that happen in gas station bathrooms or parking lots and things like that, but we want everybody to know how to use this stuff. These funds have made it possible for us to get naloxone, the overdose reversal medication, into the hands of people who need it the most. With these events and the trainings, we've empowered individuals to confidently recognize and respond to an overdose. We've distributed naloxone to individuals at risk of overdose, their loved ones and their support systems, local police departments and first responders, community paramedics and senior centers, the Burke County Jail, every Burke County public school and their staff, and we're doing that now every year since that's been put into the Burke County Public School policy. So every year I go back and train every staff member who's willing to show up for it at every school, and there's 26 of them, so that's wonderful. Peer support specialists across the county. And one of our most critical efforts, we were able to mobilize during the time of crisis, the immediate aftermath of the hurricane. So when the state level supply chains were not yet in place, these funds allowed us to step in during that vulnerable window and ensure continuity of care and access, potentially saving lives when people were most at risk, right? So the state did a fabulous job of putting things together and even providing free naloxone once they were able to mobilize and make that happen. But because of these dollars, we had naloxone available to us before that even happened, and we could get to folks immediately, so we were able to do that. The impact of this work is tangible, and we are hearing from community members, peers, and first responders who have used naloxone to reverse overdoses that in many cases, that single reversal becomes the turning point. The moment someone chooses to engage in recovery services, to reconnect with their family, or to try again. By flooding the community not only with this medication, but with the knowledge of how to use it, we are helping to break the cycle of overdose. And while we know there are many contributing factors, it is worth noting that overdose deaths have dropped between 12 and 20% nationally in the past year. And we would like to believe that our efforts have been part of the change here in Burke County. Let me be clear, naloxone saves lives, but more than that, it gives people a second chance. A chance to heal, a chance to recover, a chance to rejoin their families, and to become a part of the community again. The opioid settlement funds have made this possible, and we are deeply grateful for the opportunity to carry this life-saving work out. Thank you.
So as Brandy mentioned, naloxone actually wasn't a specific strategy in fiscal year 24-25. It was the year before that. So the commissioners approved money to purchase naloxone and distribute it. And we just continued hustling up naloxone. Every grant that we wrote, we do have, like for Brandy and for our positions, we have supplies built into that. And if we're out of naloxone, that's what we use. So we're always keeping naloxone on hand. I badger Paul about it sometimes for partners to help us out with naloxone. So anywhere that we can find it and build it into what we have. One of the things that we are tasked with through the North Carolina MOA is to braid our funding. So we're looking at something that we're funding with opioid settlement like naloxone, if we can use that as match dollars or as funds to help bring in more grants or more naloxone funding, then we can do that, and we can show a little bit of a return on investment there where we're actually leveraging our opioid settlement dollars to bring in more dollars for the cause that we're working towards. I feel like there was something else we wanted to say about naloxone. We covered the vending machine. Also, a part of what Brandy was talking about as far as our outreach goes, one of the things that's not listed in the funded list for fiscal year 24-25 is that a Dogwood grant that we had, that we actually had two. One funded harm reduction, and that's how we were able to kind of start up a port program. And the other one was for a team of opioid settlement coordinators in the Western region to come together to talk about issues that affect the whole region, like the unsheltered population. And something really neat that happened after the hurricane is we had this pipeline of communication where I met someone at the state. They said, hey, Hurricane Helene affected counties. We have naloxone for you guys. So we put it in our Western region communication portal, and we were able to say, hey, here's a contact. They're going to send us a lot of naloxone. We were able to draw down like 300 boxes ourselves and then help the other opioid settlement coordinators across the whole region get access to resources from the state and naloxone. So the footprint that we're having here in the county has a ripple effect where we are also impacting and influencing what other counties are doing and how they're using funds, and how the strategies that we're funding are complementing each other. So as we're setting up the port team, we're going to visit McDowell County, Buncombe County, and creating partnerships and developing a network across this part of the state of, well, I know that there's a treatment center and a few counties over. I know the exact person to call to get information about it, and they know if we have something here in Burke County and they have a person in need of a resource that we have, they know exactly who to call to access that to. So we've really created a community of people working in opioid settlement. So I'm really excited looking ahead to the next year. We have put a lot of effort into, a lot of energy, effort and tension into being really conscious about how we're spending this money. And that was through the collaborative strategic planning strategies, gathering information, talking to people, bringing in consultants, and getting the ingredients all around here so we can actually start cooking this meal. And I feel like that's what we're going to do this year. We're going to start cooking with these strategies that we funded. My next slide is real data heavy, and I'm not going to go through it because the people that are here behind you with the Burke County Recovery Court, the Cognitive Connection, are going to give you a much better visually digestible overview of this information here. So I'd like to invite Julie, Taylor, you guys, if you want to come up and we'll get your presentation. He said he tried now. See if it works.
Yeah. Good afternoon, everyone. I'm Julie Walker, and I'm the CEO for the Cognitive Connection. And then we do have part of our Burke County Recovery Court team, and you'll hear us say BCRC, so that's Burke County Recovery Court. So you have Taylor Setzer, who is the Burke County Recovery Court Coordinator. Lisa Wentworth is a peer support, and Chris Osworth, he's actually a graduate of BCRC, but he's also assisting with peer support and community navigation. So we are pleased to be here. I just wanted to open up and say thank you, because any type of recovery court is actually a team effort, and it lies not with only in the program, it also lies within the community. And so back in 2019, Burke County came together, and then there was some interest in reference to actually building a Burke County Recovery Court, and that actually came between the community, it came between the county, and then the providers that are now part of this, and then also the judicial side. That's a huge part of what we're doing. And so part of that team, of course, is the county themselves, and then it also is the committee that now is helping to support these programs. So we want to thank y'all specifically for continuing the funding. And then the other layer to that is that there is a BCRC advisory team that actually, it's a board level that actually meets quarterly in reference to looking at the BCRC components, program outcomes, and then also barriers, because it's also continued in reference to how do we build quality improvement in everything that we're doing. And then, of course, it's the BCRC Recovery Court team themselves. Taylor's actually going to go through the PowerPoint and give you information around that. And then it's also our members. The members that are served through the BCRC program are also team-oriented. Just to give you a little bit of context in reference to the development and implementation of BCRC, moving forward, when it was BJA funded in the beginning, basically it was unanimous that we needed to go through an evidence-based practice modality. So Burke County did adapt to the All Rise best practices. So just a very short context to this, and then we're going to get to the BCR program outline, and then some successful outcomes as well. But All Rise is actually the adult treatment court best practice standards has represented decades of research on treatment, courts, criminology, and behavioral health. The standards distill this research into actionable best practices, proving a comprehensive blueprint to enhance outcomes across all treatment courts, and this is nationwide. The reason this is important is that BCRC, even though there's no federal grant funding in place as of yet, I mean, it was funded in the beginning and then that lost momentum. Moving forward, the team, the advisory board, we still continue moving this program through best practice. And so the best practice standards is actually involving 9 different standards for this model. And so I just want to list those standards, and then actually it's evolving. We continue to get updates through All Rise when things shift, and again, it's about quality improvement. So actually, as of July 28, 2025, there has been some revisions to some of their best practice that actually flows into policies and procedures and then program updates. And so between the advisory board and your team, we are constantly staying on top of this in order to provide the best quality care. But the 9 standards that actually this court evolves from through All Rise best practice is roles and responsibilities of the judge, the multidisciplinary team, complementary services and recovery capital, community supervision, drug and alcohol testing, program monitoring, evaluation and improvement, target population, substance use, mental health, and trauma treatment and recovery management, and incentive sanctions and service adjustments. And so it's very comprehensive at that level, but again, it actually molds in a comprehensive service best practice that actually is producing huge outcomes here in Burke County. And so we're here to actually show the program itself through a PowerPoint outcomes, and then we do have some success stories. And here's Taylor.
Okay. Hey, like Julie said, I'm Taylor. I've been the coordinator since April of 2020. And we're just going to go over a little bit of the program and what we do on a weekly basis. So who we serve the high-risk, high-need, nonviolent offenders with felony or misdemeanor drug violations. We will also take other felony or misdemeanors if alcohol or drugs were involved in when they committed the crime. These usually are H&I felonies or level 1 or 2 DWIs. We cannot accept violent or drug trafficking charges. This is based on best practices that Julie was talking about, and the fact that we put people in our car to transport, so we just want to take care of our peer sports. They have to be on active probation, so we are post-education program, so they have to go through the system, be on active probation, they get referred to recovery court. Some courts, like I think Veterans Court in Catawba County, is pre-plea, so they do it all before they even enter into probation. So that's the difference in our program. They have to be identified as having a substance use disorder and willing to commit to the program. And this program is hard, it's long, and it's a year to 2 years. So it's a big commitment, but they get a lot out of it in the end. And we're also non-discriminatory, and we welcome all racial and ethnic backgrounds, genders, and expecting mothers. Referrals can come through many sources, but usually probation, the court system, task, treatment providers, or attorneys refer people to us. So this is our team. Up here, you can see pictures. This is at a graduation, and then this is when we go to the All Rise conference. So it consists of the judge, the district attorney, probation officers who they see participants as much as we do. So they do the drug testing, the curfew. They're willing to help them stay accountable on probation terms and conditions. The coordinator, which is me, I meet with them regularly. I try to see them at least once a week. And then I also come up with the docket. So I compile everything they've done in 2 weeks from all the different team members and present it to the court system before we go into court. We have a treatment provider, which right now is the Cognitive Connection. We have a lab that comes to court to explain the drug screening and what the results mean. Defense attorney, and that is Charles Boston. He's amazing. He represents them in their legal rights. And then our peer support specialists are on the team as well. So this is how our pre-court staffing works. We all meet before court for about an hour, and everybody on the team gives the information to the judge, and we give our thoughts and ideas for incentives and sanctions, but at the end of the day, the judge makes the final call. So some of the incentives we have, praise from the judge, applause from the courtroom. We ring a bell if they're in compliance, we cheer. Certificates of achievement, gift certificates. Sometimes when they're in compliance, they get a coupon so they can miss court or group if they're in compliance. So it helps them if they're working or their moms, if they have too much to do in a day, they can take a day off. We do recovery medallions and sobriety chips. We have a prize box, and then they also spin a wheel when they're in compliance, and it takes money off their probation fines and fees. And that's a big deal to them because they can rack up a whole lot in probation fines and fees while they're in the program. And then they get promoted as they're complying the program, and then they graduate, of course. And then sanctions can include speeches, presentations, community service, curfew, electronic monitoring, house arrest, increased duration of the program phase, increased drug screens, and jail time. Sometimes we have to get creative and think outside of the box. I think recently we had someone write down everything they do in a day, so a daily schedule, because it's case by case. So sometimes jail doesn't work for people. Sometimes presentations, they're okay with public speaking, so it does nothing for them. So we have to really think outside the box and go case by case for each participant. So the benefits of the program is it's person-centered, so they get person-centered treatment, counseling, and peer support. We help them with resources, housing, education, employment, transportation. Peer supports are running the roads like crazy, getting them to their appointments to make sure that they are getting the best care that we can help them with while they're in the program. We have a primary care on site. We have MAR on site, so we're just constantly working to give them holistic care. It also offers accountability to the sanctions and the incentives, so they're constantly being held accountable for their actions while in the program. Motivation, again, with the incentives. And then we also offer financial assistance for Medicaid-assisted treatment or recovery. That's the Suboxone, the Vivitrol. Through the county funds, we get to help them with that, which is a big deal for them, because it can get expensive if they don't have Medicaid. And just some statistics real quick. We have kickball tournament every year, and I will say Burke County Recovery Court has won 2 of the years, so I always like to point that out. It's one of our community events. We had 5 teams this year, 6 teams participate, and it gets bigger every year. It's a big deal. You might recognize some faces up here, but we do that every year. It's just a fun time for them. The judges come out and play, officers come out and play, treatment providers, we're all out there playing or at least doing something. So it's a good activity for them to see that the team does support them, and it's not inside a courtroom. But according to All Rise, they have found that drug courts reduce rearrest rates and reconviction rates 8 to 26%, and most fall between 9 and 15, and we are at 15, so we're on the higher end of that. Our success rate for just this year is 33%. Keep in mind this is a 1 to 2 year program. So if they started this month, it'll take them at least till next September or really December if they're compliant the entire time. We've served over 122 different participants in the last 6 years. And then our call savings since 2019 is over $9 million for the county. Currently, we have 15 participants. We just had 6 or 8 graduate, so we're refilling. 9 in phase 1, 4 in 2, 3 in 3, and 1 in 4. There's 5 phases in the program. 40 participants have completed the program and graduated. One's back here. And we have 8 pending referrals that will probably be signed in the next month or 2. So I can talk all day long and read numbers to you, but I think the success stories are much more important. These are real people in real lives, and this is how their lives have been affected. So I'm going to let Lisa come up and tell some success stories, and then Chris is going to tell his. Thank you, guys.
Hello, I'm Lisa Wentworth. I'm peer support for Recovery Court. I've been there since almost the beginning, about 5 years. Me and Taylor have been a great team. We have a lot of success stories. You might recognize Ashley. She came into Recovery Court in June of 2020 and graduated. She regained custody of her daughter and employment by working 2 jobs. She was also able to purchase a vehicle. She got dental work while she came to our office because we have a free dental clinic. If you're compliant, you can go to our dental clinic. She's now a peer support. She's on the poster y'all saw a minute ago. She's also working for Restart in Caldwell County and will be the recovery court team in Caldwell County when they begin their program in January. Do we have a picture of Kristen? Yeah. Another success story. Well, this is Sam. He was graduated from the program in 24. He started the program. He was living in the back of a convenience store where his mom worked. He had a very serious fentanyl and Xanax problem, and while he was in the program, he chose to go to detox. He moved into Oxford. He's now fully employed at Omara. That's his wife and his beautiful baby. He got his driver's license reinstated, and he's just saved up enough money to buy a house. And this is Miss Kristen. She began the program in late March of 2024. She had a very serious fentanyl and Klonopin habit. Within the first month, she was found in her front lawn of her house overdosed. Another participant on the van that went to pick her up had to Narcan her. She still fought the process a little bit. We took her to the hospital, she detoxed, she still fought it. We took her to court and they had to pry the Medicaid, well, she said it was prescribed medication, Klonopin, it was like 88 pills out of her hand. She went to jail, stayed there for a little while. We got her into the cottages over in Catawba County because housing is so short in this county for anybody. We had to reach out to a neighboring county to get her in somewhere because she wasn't willing to do Oxford. She wouldn't do Dove's Nest. She wouldn't go anywhere. So we got her into the cottages. She did well till she graduated from there, went home. She's been going to outside meetings. She's advocating for the program. At the end of her getting ready to graduate, she was sitting in the lobby advocating for recovery court to other people. So she completely turned around. She graduated in June of 2025. She has a full-time job and getting her driver's license within the next year. And one of our greatest success stories is standing behind me. He now works for us, so I'll let him share his story.
Hey guys, my name's Christopher Ottstott. I've lived in Burke County about 20 years. I'm 33 years old, so most of my life I've lived here. Started using drugs when I was 9 years old. So by the time I entered recovery court, I'd been using for almost 20 years of my life. In and out of trouble with the law, you know, taking and stealing and pushing everybody that loved me away. So, you know, I got in trouble, joined recovery court, didn't want to be there, thought I could manipulate my way through everything like I have my whole life. You know, thought I could get by with it, do the bare minimum, and just skate by. But that wasn't the case. But like my whole life, I'd never had somebody show me really unconditional love like the team did. They mean a lot to me. They helped save my life. You know, I had to put in the work myself, but they were there to support me through the whole thing, to encourage me, to push me when I needed it, to motivate me. You know, Lisa was my peer support to start this whole thing off. You know, she was amazing. Just, you know, hearing her story and how she did it, you know, it inspired me and gave me hope that I could do it as well. I was an IV meth user for quite a while. You know, just I had lost everything. I lost my kids, lost all connection with my family. You know, I was hopeless, living in a trap house, like holes in the floor, you know, just, you know, beat down bad. I'd lost all hope and just really lost my will to live. And through recovery court, I gained all that back, you know, through their help and through their motivation, their support. And, you know, I fought back and I pushed back a little bit, but, you know, any addict is going to. When you've lived in active addiction for 20 years, it's going to take some time to change your life. It's not going to happen overnight. But, you know, they were there the whole way. They continued to support me. They, you know, gave me any kind of resources I needed. Was always encouraging. You know, I was fighting the program, and I tried to sober up for a little bit to pass my drug test when I went to court, you know, I'll just stop for a few days and I'll go to court. And I went to court and I failed my drug test, but they still gave me a chance to go home. Well, that same day, I went home and, you know, meth was my primary use, but I didn't discriminate on any kind of drug. So I went home and I used fentanyl and I overdosed that day. First time I'd ever overdosed in my life. And luckily somebody was there and Narcan me. And about 2 weeks later, I came to court and I went to jail. And they gave me the option. They were like, you can go to prison, you know, because you're running out of time. You know, you got to get this thing. You can go to prison or you can go to rehab. And I've always said my whole life that I was the worst decision maker to ever live. Like, you could hand me two good decisions and I'm still going to choose the wrong one. But it was, you know, experiencing that overdose and thinking about my kids and thinking about my dad, who was never there because he was a drug user my whole life, and you know those things. You know, I was like, this is my chance to make that right decision. So I did. I agreed to go to rehab. Spent 4 months at the Charlotte Rescue Mission in Charlotte. It was a great program. I came back, still doing the program. Graduated in September. I signed in February 2022. I graduated September 2023. You know, they were there to support me the whole time. And they also encouraged me. I always felt like I was meant to help people, even in my active addiction. I was always the one trying to help others, but you can't help people when you're sick, you know. But so they always encouraged me, like, you got a knack for this. You should do this. You should do this. So we finally came to an agreement, and I joined the team, and I couldn't be more grateful. My recovery court saved my life. And to give back, to stand there and be able to share my experience with the people who are sitting in those seats, who are struggling, who come to court terrified, don't know how to change their life, you know, and I can stand there and advocate for them and stand beside them and say, hey, I know what you're feeling right now. I know I've been through it. I've done it. I've lived it, and here I stand, you know, as a beacon of hope. That it is possible to change it after 20 years of active addiction. So I couldn't be more grateful for the COG and for these two people standing here. Without them, I don't know that I'd be standing here, but I've gained my kids back. I now have custody of both my kids. You know, I got a good job. I work 2 jobs now, you know. And I've just gained my family back, and my life today is better than I could have ever imagined. You know, I still ain't exactly where I want to be in life, but you know, I'm going to continue to grow, and I'm going to continue to help others, and you know, through recovery court, and that's all I got, guys.
And again, thank you, and that comes from the BCRC team, the advisory board, and just thank you to the committee and the county for continuing the funding for these programs. Thank you.
So the last thing that I had on my presentation was just looking ahead, looking at the things that we hope to accomplish in the next year. We have lined up appointments or meetings with the three providers that, if you all recall, when we did the request for proposals, we had a category where 3 providers were in this go back and revisit pile. So we've scheduled meetings with them, and that was Burke Recovery, Christ-Centered Recovery, and Catawba Valley Health. So we'll be meeting with them in October. Our next meeting, we're going to be meeting with them at the end of this month, first week of October, so that when we meet again in November, we'll be able to have some recommendations about those proposals. And have an update on the implementation of the approved strategies. So we're going to go full force ahead into implementing those approved strategies and looking at working through the rest of the applications so that we can potentially reopen that application process in the spring. And so that is all from my presentation. I'm going to open it up to you all for questions, comments, discussion.
I have a question about PPE. So sure. PPE was put together before the Opioid Advisory Committee, wasn't it?
Yes.
Okay, and so when did PPE do the poster campaign? Was that not February of 2025? Mm-hmm. So we're coming back up on that again?
Right.
Where does the funding stand for the PPE to continue?
We no longer have any funding. That finished out at the end of the previous funding year for the opioid settlements. So we don't have any funding right now.
So given the amount of work that the PPE is doing, how can we refill that funding?
I guess the opioid advisory committee would have to propose that to the commissioners to see if we could get funded again.
Do you guys feel comfortable doing that?
Yes.
So do I make a motion or do I?
Ask him.
Can I make a motion to refill the PPE's funding for the next year? Because did that last you a year, Brandy?
Yeah, actually, I didn't come into the position until about halfway through the year, so we didn't use all the funding that they had. So if we were given a full year to use, let's see, I think that there was $30,000 on the table, and we only used about $8,000 in the half of the year that I was there. So whatever you guys see fit, we could work out a budget, and we would be happy to do that.
So there was money appropriated that is expired?
Yes. And we're back into the opioid settlement funds.
So only 8,000 was used, but you were only there for half the year. Okay.
So there was 22 left on the table.
I guess your motion was probably fine that we proposed to the commissioners that they refund that for a year, and we'll let them figure it out if they need. I guess we could. Where Brian go? Is he still around? No. I guess if you want to put an amount that we recommend that they reinstate the $22,000 that they had previously proposed.
Okay.
Is that your motion?
That's my motion.
And I can look and put the exact amount in there, whatever was left in the request.
I did want to add something with that. As a peer trainer for the state, I know that right now I have 3 classes left for the year, and the biggest problem I'm having is funding for people. I had a scholarship before that the government took away, so trying to get people into training for the cost of the training, I didn't know if that's something, I know Brandon has helped before with PPE, trying to get people certified for the training.
Was that some of your funding was helping?
Well, there's clear evidence that we could do that and make that workforce pipeline functional. I just need to find out how we could make that work if it's part of the strategic planning, if we could make that work as far as being an option A, if that could be available through the option A funding, could we make that work?
I'll have to go back and review the MOA. The way that we funded it the first time was under Strategy 1, Collaborative Strategic Planning, as a way to build this coalition. And now that the coalition is built, I need to make sure of what strategy A or option A strategy it fits under best, and then what we can do under that strategy. So it may be collaborative strategic planning again, or it may be something else.
But if we can certainly use that and make it happen. I mean, we have a waiting list of people who would like to become certified as peer support specialists, and then we have jobs waiting for them if we can make that happen.
I can't remember these names. Do I need a second or we just vote?
Need a second and vote.
Need a second to vote? Okay. Is there a second? All right, we have a second, motion and a second. All those in favor, please signify by raising your right hand. And that looked unanimous. All right, along with that, did we want to make a second motion for funding of peer support?
Does that need to be a second motion if it's still falling under the PPE, or does it? I can tell you what it looks like. I can only have 12 people in the class. The class is $350. I have two classes in October and 1 in November, and then I'm done to the first of the year. So it's $350.
That falls under PPE, or a budget needs to be proposed, right?
Go up.
I believe that's going to fall under PPE if it meets the strategic plan.
That's what I thought. It would fall under PPE. So I don't know if that's another motion or if that's just letting you know how much it's going to cost for the additional that's going to be needed.
So let's do this. Since the motion is to reinstate funding for PPE, what we can do is build a budget around the remaining amount, like how we intend to use it, And if there needs to be additional funding for, specifically for peer support training, then we may need an additional resolution for that. So we'll come back when we meet again with the budget resolution drafted for you all to review of PPE and what will be funded through it. And then if we need a separate resolution, we can draft that as well for you all to review. And that way we can get an estimate about how many people, what the cost is, and that kind of thing.
So when that goes to the commissioners, will they be able to see potentially that they're funding spots for peer support classes?
So we'll come back here in November and I'll give you all the overview of how we've itemized each budget, and you all can approve it or we can edit it. And then we'll get it on the agenda for the Board of Commissioners, and I'll give them the whole presentation about exactly what they're approving funding for.
Well, but this motion should go to the commissioners meeting this month.
The upcoming one, is that in October?
Yes, the next one is in October. Hugh, what do you think about as far as the timeline for getting another resolution in front of you?
I think we could get a resolution in October. I think if this group has a dollar amount in mind, we could put together a budget as long as it's under that dollar amount and put that in a resolution for October.
Okay.
So
And that would help you with,
So October is where it's going to make the difference, because the classes have a weekend class because everybody works another job.
Right.
So that one makes sense. That's the end of October and the 1st of November. My next class coming up is October 13th to the 17th, so I don't even know when they would meet again. And I know the exact amount we would need to cover 12 people for each class. It's 12 to 6. So that'll give you 32 people. I'm not good with math. I don't math very well. So October, I'm just looking for the schedule.
so the motion we just made won't help you for the 13th class, but could help you for the last.
Yes, the last 2 classes for sure.
And what I'm kind of thinking is that we probably do need 2 separate resolutions, one for PPE under strategy, or option A, collaborative strategic planning, and then a second one under, where did it go? Employment-related services. So I just have to look and see where it fits.
Why don't you do that then, if you have a motion, and you said how many spots?
12.
12.
Per class.
In 2 classes that this would
Yes, so that's 24.
And it's $350 a spot.
Right.
Okay, so whatever that math is, 24 times 350.
So tell me that one more time. 12 spots, 3 classes?
12 spots in 2
Only
classes.
2 classes.
That she has left.
$8,400. Thank you.
What was the price per person?
$350 a person.
$350. And the total was $8,400?
$8,400.
Okay.
24 spots, $8,400.
Thank you.
All right, so you want to make that motion?
I do make that motion.
There it is. All right, so it funds 24 spots at $350 a spot, $8,400 total for the commissioners for those 2 classes is the motion. Is there a second?
Second.
There's a second, motion and a second. All in favor, please raise your right hand. And that looks unanimous. Any other motions? Any other discussion? That brings us to adjournment.
Before you go,
Yes, sir.
please. Katie had mentioned in an email that there was a request if anybody wanted to go with them to visit TROSA. And I think each of you saw it in your email. I was going to ask Katie if she has the information, why was there a visit to TROSA?
There was recently was it the annual conference for the North Carolina Association of County Commissioners, and a representative from TROSA was there, and Mr. Epley and Commissioner Barrier had some interaction with him. I believe he was either the COO or the CEO, and shared his contact information and invited us to come down and tour TROSA and see what they're doing down there.
At the end of the meeting, are they going to bring back some kind of proposal or something about TROSA?
So the way that I see it happening is I'll bring you guys back the information like what we learned. But as far as I know, there isn't an objective to develop any kind of budget request or anything from it at this time.
Yeah, I've had a number of dealings with TROSA. I admire some of the things they do, and I do not admire some of the other things that they do. With your permission, Katie, I'd like to send you an email with some of my thoughts concerning TROSA, and if you feel that it needs to go to this board, I would not have any problem with you sending it to this board, if that would be okay.
Yeah, absolutely.
Any other business? All right, with that, I'll accept the motion to adjourn.
I'll
I move that we adjourn. Motion and a second. All in favor, please raise your right hand. That appears to be unanimous as well. Thank you all.